I'm now in conversation with Joao Bocas, who's a worldwide renowned wearables expert. I've known Joao for quite a number of years, and it's a pleasure to invite him to say a little bit about his background and the work that he's doing now with wearables. So, how did you first get involved with wearables?
Hi, David. A pleasure to be here and nice to see you as always. Well, my first contact with wearables, let me tell you a bit about my background. I was actually involved in professional sport and fitness and wellness for a number of years, and then I transitioned to corporate wellness in healthcare. I've been in healthcare for over 15 years now. I had, of course, a personal interest in health matters and fitness and sport, but also, my first involvement with wearables was about 5 years ago when I was doing health tech startup with a business partner, and he was more of the technological brain, and I was more the business development and the guy bringing things together. And our idea was to get health data to wearables to connect with the analytics platform to perform, health analytics in the future and predictive analytics as healthcare was starting to evolve.
Okay, so that's how you started, and how has the business transitioned as technology has developed? In particular, I've noticed that a lot of wearable devices, which initially began as more or less step trackers and uh, really limited health data from them, now the big thing seems to me is getting FDA approval and clinical validation. How has technology evolved over those 5 years you've been involved?
Well, they evolve very rapidly and fast, and actually, it's very good that you distinguish that because there are two categories if we're in wearables, if you like, the health, fitness, general wearables, if you like, around more the general fitness health data, if you like, and then are the medical wearables. So the latter have evolved really fast. You know, now is of course a big push in healthcare to utilizing wearable technologies to getting meaningful insights of patients, health signs and vital signs remotely and also on the ground. So what I've been noticing, David, is that the wearables definitely became more intelligent. I mean, in terms of predictability, robustness of the data, they become more reliable because a constant issue is about is the data reliable or not. And if we're talking about the generic fitness usage, if there is a discrepancy of, let's say, 10% of 100 or 200 steps is not that important. But when we're talking about a particular health issue and the discrepancy of 10 or 20%, for example, in a heart rate variability, it can actually be crucial about making a decision making in clinical terms. So they're becoming more intelligent, more reliable, more powerful in terms of the computing inside, but also is a big trend now. They become smaller and more, and really much more reliable and becoming a really allied, a partner that you cannot go without in healthcare terms because now there are medical devices everywhere.
Yeah, absolutely. Do you see the medical devices that are genuinely producing valid data? Um, are they are they evolving to also be fashion items, or is that really just restricted to the traditional health and fitness devices?
Well, fantastic question. I mean, there are many trends occurring now. One of them is fashion tech, but also if we look at the main manufacturers, and I don't want to refer any brands, but there are actually the main manufacturers now that are making that transition. We see, for example, a lot of smart watches that had lots of capabilities and data already available that actually transition now into the deep medical healthcare space, providing, for example, ECG on a pulse. So now we see that transition really on the ground, and the users are actually starting to adopt these technologies on a scale, and the main manufacturers, I mean, they really leveraging this opportunity about making the medical devices more sophisticated.
One of the things that I've also observed is maybe this is just a feeling that I have, but I sense a lot of manufacturers are a little bit wary about getting into the health space, particularly with using artificial intelligence and using, in inverted commas, smart coaches to advise people on physical activity and things that they should do. Do you see that potential litigation against manufacturers of wearable devices based on inaccurate guidance or tips they might give? Do you see that as being a problem or a barrier to the development of the industry?
Well, good point. Absolutely. I see that definitely as a concern and a challenge for the manufacturers, but also one other issue, and I'm thinking about a particular example without mentioning names. Very recently, one of the leading wearables companies bought a health coaching company. There is a reason for that. One, to close the gap about supporting people using wearables on a sustainable terms, but also when, for example, a big manufacturer offer a medical capability, there needs to be or should be in the first place some kind of support behind the service, and that is actually a mismatch. Some of the manufacturers, they provide you the device, is a medical graded device, but then if you have a problem, there is no call center, there is no assistance. Even if you have an alarm about a concern on your heart rate or other particular issue, there is no support behind that. So the infrastructure is not in place. It's not just about building a medical device. It's actually about providing a service that supports that and brings everything into one loop, and that often is not seen.
No, I agree with you. I've used quite a number of different wearables over the last few years. Like you, I started 5 or 6 years ago with the Jawbone Up. I can mention them because I don't think they're around now, which is a great shame because I've seen how different manufacturers of wearable devices have used different gamification techniques to influence behavior and improvements in fitness. In the case of the Jawbone Up, they introduced something called Smart Coach, and that was really based on giving you links to bona fide health sites. So if it detected something, they didn't give you the advice directly. They pointed you to a website that was from some kind of authority. So they provided their kind of support, not directly, but indirectly by referring you to another authority. I've also seen other techniques used to increase or provide motivation for physical activity. That's one of the things that interests me, how people go about that. I think one of the devices that I used, they basically translated your steps into some kind of metaphor. So if you've done however many thousand steps, they would say you've just walked around Lake Windermere, or you've walked from Edinburgh to London. And they were giving that kind of analogy to encourage you to get involved in more physical activity. But there are lots of things that we could talk about, and I'm sure we're going to be covering some of these during the webinar. I just want to go to the corporate use of wearables. When we were talking earlier on, I mentioned the corporate social responsibility and the concept of large organizations actually providing wearable devices to all of their employees
Mm.
as a way of providing some kind of health benefit. Are you seeing this happening at all in within corporates?
Well, I was actually in corporate wellness for a number of years, and health and wellness programs, they were very, very popular a few years ago. Now I see the employee benefits companies offering the services and support in a different place. I mean, in a different way, if you like. But
Mm-hmm.
definitely is a direct correlation and a link to benefit of the health of employees. I mean, with regards to absenteeism, I mean, claiming less on insurance and even being reducing sick days. But going back quickly to your previous analogy of the giving meaning to a distance, for example, to give intrinsic motivation.
Mm.
I have done actually 1 year health engagement wearables report and 159 pages, by the way. But in that report, one of the user barriers, if you like, was the lack of intrinsic motivation.
Yes.
So it needs to be actually an attachment. It needs to be meaningful for the person, for the user, and it needs to be personalized, because what is relevant and what is appealing to you might not be appealing to me. So I just want to make a remark in that sense. But definitely there are big corporations now utilizing the power of wearables to engage their employees with health and wellness primarily, but also there are other benefits such as employee advocacy. It gets people talking. What
Mm.
about how many steps have you done? Did you
Mm.
sleep well last night? I mean,
Mm.
are you still using yours? I mean, did you charge yours? What is your model? Whatever gets people actually. And I think one of the things that big corporations are really interested now is in having a level of happiness in the workplace, because there are a lot of research about retention and
Mm.
engagement. So the wearables not only give you that element of health and wellness, but they can actually link you to other important things. So definitely the corporate social responsibility piece is a way to engage.
Okay. Moving on now, you mentioned insurance. That was one of the words I picked up on when you just talking about that. Um, do you see uh, insurance companies starting to do more of a link between a wearable device and insurance policy? I won't mention any names, but there are insurance companies who do offer discounts or larger uh, payouts for people who take up a wearable and provide the data. Uh, it's the analogy that I use is in the motor industry. You know that so there are some insurance companies who give quite significant discounts to young drivers who have a black box fitted inside the car
Mm.
that monitors how well they're driving. Are we likely to see that kind of thing in the health sector? People being rewarded for being able to demonstrate their their physical activity, etc., their sleep patterns, etc., or do you think that's very dangerous ground to go on?
I think, David, inevitable, we are moving in that direction, and the conversations in the health industry, health insurance industry, they've been ongoing for the last 3, 4, 5 years that I remember. There is one thing in here that I noticed, and I actually been involved in some insurance thought leadership events. I've done a keynote in London and somewhere abroad, and the insurers are very risk averse. You know, anything that is new, they need to see it developing in a marketplace and make sure that actually is a concrete business case around it. But there is a leading company, without mentioning names, I'm sure you know them,
Yeah.
that have a leading program, a rewarding program in place for several years before the wearables came along. They're already giving rewards to points translated to discounts in shops,
Mm.
cinemas, and
Mm.
coffees and things like that. Now the wearables became a natural fit there, you know,
Mm.
and I think is a natural progression in the marketplace if the leading, let's say, provider are doing it. I think it's just a matter of time the other companies will follow suit. And I think one of the challenges for the insurers is not just the health data provides a challenge around security, around personalization, but how they can, there is no, how can I put this? There is no 5 or 10 years of historical data that they can claim. They say, okay, we know from the last 5-10 years, if you exercise in that matter, there will be a direct correlation and link. So because the market is new, they don't have that evidence to kind of fit in around the claims process. And that has been the challenge, and I believe has delayed that the implementation and adoption for a number of years. I think it's just a matter of time that everybody will be doing it.
Yeah, I certainly agree with that, and I'm going to look forward to your research report. I think this needs to be spread more widely to let people know that you've actually done quite some significant research in this area to link the effects of wearables and motivation and behind the use of wearables. So I'm very grateful for you giving your time for this interview, and I'm looking forward to speaking to you again next week when we have the webinar on wearables and COVID-19 and continuous remote monitoring. We've got quite a good panel lined up with yourself. Someone that I know called Chris Barker from Spirit Healthcare will be joining the debate. Their company provides solutions, particularly for people with chronic healthcare problems. So I think it's going to be a very interesting debate. And once again, thank you very much for giving your time this morning.
Likewise, David. Nice to see you. Thank you so much.